And thank you for joining us. With us is Michelle Carr, RN at Meadville Medical Center. Michelle, thanks for joining us.
You're welcome.
Before we get into what we're going to be talking about, tell us about yourself.
Oh, I have worked here since 2001. I started out on 3 North, and then I worked up there about a year and came down to recovery room. And I've been in recovery room. I worked there about 18 years. Took a sidestep to the utilization management department for a few years, and then came back to recovery room. I work part-time in recovery room, and then also in the quality department as the sepsis coordinator.
Very nice.
Yeah.
What led you in this direction as a career?
The predecessor as the sepsis coordinator put the bug in my ear one day that maybe I would want to do this after she retired someday, and that is exactly how it worked out and happened. And so it just kind of happened that way, and I love it.
Did you know at a young age you wanted to get into the healthcare field?
Oh, very young age. In fact, my mom always tried to get me to pick, my mom is a nurse also, so she would try to get me to pick a backup career in case I wasn't sure about, but I just could never think of anything that I wanted to do as much as being a nurse.
Oh, that's fantastic.
Yeah.
So this is an interesting topic we're going to get into because people hear this term but might not know what it means exactly. We're going to talk about sepsis.
Yes.
Let's talk about it.
You may have heard of blood poisoning as a way to describe sepsis. However, sepsis is the body's overwhelming and life-threatening response to an infection. The body will attempt to fight the infection, and sepsis is a condition that arises as the body's response to the infection causes it to damage its own tissues and organs. Infections could be bacterial or stem from a virus, also parasitic or fungal in nature as well. And infections don't have to be something larger like a pneumonia. They could come from something much smaller like a paper cut or a hangnail or a scrape or a burn. If you would notice that you have an infection that's not getting any better or is getting worse, it would be important to contact your physician or your provider and have them evaluate you. The Sepsis Alliance uses the word T.I.M.E as a mnemonic to help us recognize some signs and symptoms of infection. The T would stand for temperature, so if you have a temperature that is very low or very high and you may be experiencing fever, chills, or shivering, the letter I would stand for infection. So if you do have a cut or a break in your skin that you notice is red or warm or might have a whitish drainage coming from it. M would stand for mental decline. So if you're confused, groggy, sleeping all the time. E would stand for extremely ill. So if you have a new or increasing pain or discomfort or shortness of breath, these could all be signs or symptoms of infection. And if you would experience 2 or more of those, it would be important to get to your provider and be evaluated.
There's always that window, right, where people are trying to figure out, okay, is this something that I can get over versus, okay, I'm not getting over it, maybe I should go to the doctor or the ER. What do you say to folks who are sort of balancing, those types of questions?
I would say to err on the side of caution. If you do feel like you have an infection that is maybe getting worse or is just kind of hanging around and not really doing anything, go get checked out and let them lead you with what the next steps would be in the treatment of it.
Is there ever any confusion with like having a fever and the body's ability to try to get rid of that virus that way versus, okay, you've had this fever too long and we should have somebody take a look at it? So
we say if you have a temperature greater than 100.9, then you should definitely consider that a sign of infection and get checked out.
Okay. At that point, they're coming to the hospital. What's your response to that patient? I realize it's going to be different for everybody, but what sort of things are you dealing with at that point when somebody has been diagnosed with sepsis and you have to step in and start that process of figuring out what we're going to do?
Well, when they come to the ER, they'll do labs and check different labs looking for signs of impairment of their organs. Some of the blood work that we do would show signs of that. If the provider in the ER feels that that is what is happening, then they would get antibiotics started, maybe want to start some IV fluids, give them a little fluid bolus while they're in the ER.
What sort of questions do you get asked when you're out in the community? People may recognize you from being up at the Crawford County Fair in years past. What's that interaction with the public like? What sort of questions do you get?
I don't get so much a lot of questions from them, but I get a lot of people recounting their own personal experience with it, or someone that they know who has had sepsis before and how it affected them and their family. And they like to share their stories with me and tell me how things went for them.
You mentioned paper cuts to hangnails. It sounds like there are a lot of opportunities to welcome an infection into the body, and a lot of things people might just brush off. Mm-hmm. Maybe highlight some of those things again that you might want to be paying attention to.
Right. Well, anytime you have a break in your skin, so if you have a scratch or a burn or a scrape, any opening in the skin is a place that germs could get in there and cause an infection. So it really could be any little thing that could lead to an infection.
Are there things that somebody can do right off the bat if they get that paper cut, if they get cut out in the woods or get
Certainly.
burned?
Keep that area clean and dry. If you have access to put a dressing on it when you're out in the woods, do that. But certainly when you get home, wash it with soap and water. Try to keep a clean bandage on it. If you have to touch it, make sure you wash your hands first before you touch it, and just try to keep it nice and clean and covered so that none of those germs could get in there and cause trouble.
And obviously once they get to the hospital, there's a lot of precautions that take place to make sure something isn't picked up while they're in the hospital. Is that a stressful side of the job? Maybe talk a little bit about those steps that are taken to make sure that once a patient's in the hospital, they're not going to pick something up.
Right, well, we do universal precautions while in the hospital. So anytime somebody would have to touch that opening where the infection is, they would always have gloves on to prevent transmission to the patient, and also from the patient to the person examining that area.
I think September is Sepsis Awareness Month.
Yes, it is.
What's involved in that? And again, maybe just highlight those things that people should know or that you'd want people to know.
Okay, well, Sepsis Awareness Month is always in September. September 13th is Sepsis Awareness Day. And so here at the hospital, we've been kind of going around from floor to floor, trying to do a little bit of education and giving out prizes and treats and things like that, just to keep sepsis in the forefront of people's minds as they're treating their patients, and keeping those signs and symptoms at the front of their brain also, so they can maybe pick up on it a little quicker than maybe they would have normally.
What's day-to-day like for you at work?
As the sepsis coordinator, we do a lot of data abstracting. So we get in the patient's charts and look for the time frames that antibiotics were given or IV fluids were given, and what their vital signs were or are, lab values too. Those are all things we would use to help diagnose if somebody may be septic or might meet criteria for sepsis.
And it varies from patient to patient on maybe how quickly antibiotic or something would work on the patient?
Certainly, yeah. They may get started on an antibiotic in the ER, or if they are determined to be sepsis once they're an inpatient, and then they are able to get some test results back and figure out what particular bug is causing the infection. The physicians may then change the antibiotic to one that is more specific to that germ.
It sounds like it's a very rewarding career, maybe stressful at times. What do you do at the end of the day to unwind?
Oh, this time of year, I just really love to go home and sit on my porch and listen to like the birds sing and watch the squirrels try to eat all the bird seed out of the bird feeder.
Yeah. Any hobbies?
I like to read, so I'll read my book. My husband's working second shift now, so the evenings are very quiet. So usually I'll just sit out on the porch and enjoy my dinner out there if I can.
Any favorite vacation destinations?
No, well, my son is getting married next year in Jamaica, so
wow,
that's
congrats.
been our focus lately, is trying to get things ready for that. So I've never really been out of the country except for Canada, so I had to get a passport going and We've been talking with the travel agent that they're using to try to gather information and get ready to roll.
What's it mean to you to be able to work and live in Northwest Pennsylvania?
Oh, we love it here. I love all the seasons, and over the years my husband and I have talked about moving different places, and one of the, earlier on in our marriage we were talking about maybe moving to North Carolina, and he specifically mentioned the Raleigh-Durham area because the weather is nicer down there, but you still get a little bit of all the seasons. But fall is my absolute favorite season, and I wouldn't want to go anywhere where I wouldn't be able to see those colored leaves in the fall, because that's the best for me, I think.
What's it mean to be part of Meadville Medical Center and just going out in the public and having that, we mentioned being at the Crawford County Fair, but to have people come up and share those stories, it must make you proud to be part of such a great organization.
Yeah, it really is a great organization, and people are so friendly around here. And I have worked here for like 24 years, so I've gotten to the point where I know most of the people. I remember when I very first started and everybody was a new face to me, but now I recognize a lot of them, and we've gone way back and carry on conversations and know about all of our family members, and that's been nice. And you realize too, living in a small community, you see people inside of work and outside of work, so it's nice to run into people that you know out in the community as well.
Well, we thank you and appreciate everything that you do for us and the community.
Oh, well, you're welcome. Thank you for having me.
And we want to thank you for joining us and getting to know Michelle Carr here at Meadville Medical Center.